in South Africa. I live here with my family. Um, with me here are my two sons who were born in South Africa, and the first one was born in 2016, and the last one was born in 2020 in the midst of coronavirus. And I would like to share my experiences with you in South Africa being a father. And I would like to say that I experienced fatherhood, being a father for the first time in my life in South Africa, and I would love to share that experience with you. Perhaps the experience in Ghana could be different, or elsewhere, depending on where you're watching me from, could be very different. And I would like to say that South Africa has given me the opportunity to be a father, and I'm going to share with you the reason why I chose to be to speak about this. So in 2016, I want to give you a history um, about my firstborn and the secondborn, and how the South African health system, through government policy, you know, made it so seamless. Having to nurture the pregnancy from the first day up until the day of birth, and the experiences we went through the antenatal care, the maternal care. I'm gonna share everything with you, and it will blow your mind to know that an African country, in fact, a third world country, is able to provide this kind of services to its citizens to the extent that it doesn't even reach. It doesn't only end with its citizens, but each and every person who lives in South Africa. That is beautiful. It is beautiful because I come from a place where the healthcare system is based on cash and carry. That is, if you do not have money, you do not have access to medical care. And so coming to South Africa, I had that mentality that if you get sick, you would have to pay before you get access to medical care. So my first experience was when my wife, got pregnant in South Africa, and we went to the hospital for the first time to register the pregnancy, and they opened a folder for her. They didn't ordinarily in my country. You may be asked to pay a certain amount of money for the card, for the hospital card. I So we went to the hospital with money, hoping that that would be the process. So we go to the hospital. The doctors, the nurses did what they had to do. They opened a register, a folder for her, and everything started from there. We were not asked to pay anything. I was shocked. In fact, when we were coming back from home, I asked her, "Did you pay anything without me knowing?" She said, "I paid nothing." And I was completely, stunned because in my country that doesn't happen. I'm from Ghana, so I'm using Ghana as an example, as the case study because that's where I come from. So we came home. So every month she would go for her antenatal care, and once Friday night, while we were going home from work, she went into labor, and so I had to call the ambulance. So I quickly called the ambulance, and within some few minutes they were there. Within 5 minutes they were there. In fact, we were not staying far from from the emergency services office, and so immediately they came up. It was around 10 o'clock, 10 p.m. So they immediately came. They picked her up with the ambulance. In fact, they checked, and they realized that the baby was very close the to coming up. So they picked her up, and I went to the room hoping that I would go and take my card and go and withdraw money and give it to them. Because in my country, when you call the ambulance, you must pay for the services. And so when I came back, they had already left. I was completely shocked, and I was worried completely. So I went to my next door neighbor who was also a nurse and asked and told her that I wanted to go and withdraw money, but then when I came back, I realized that they had left long ago. And she was like, "Withdraw money for what? Withdraw money for what?" I said, "No, to pay for the transport and the services." And what the woman said really shocked me, and that made me pick interest in South Africa even the more. She said, "Why would you have to pay for for when a woman? Why would you have to pay money when a woman is going to deliver? When somebody is in labor?" I was like, "In my country, you have to pay. In my country, you have to pay." And so I had that mentality coming from Ghana. And she was like, "No, that is not done in South Africa. Everything is free," which is why from the first day you went to the clinic for her folder, you never paid anything. Medical care is free, especially for pregnant for pregnant women. That really struck me because I began to realize, I began to think about the number of women who have passed on due to lack of access to medical care, or due to having funds to pay for medical care, for antenatal and maternal care. That really struck me. So I wanted to go to the hospital immediately because the hospital was like 35 kilometers away from where we're based, and so I wanted to go to the hospital that very night. And she was like, "What are you going to do? Even if you go to even if you get to the hospital, they will not allow you to enter. So just sleep. Tomorrow morning you go and check up on her." So in fact, that night I couldn't sleep because that was my first experience, and so I prayed and prayed and prayed and prayed and prayed. And unfortunately, she didn't go with her phone. So couldn't communicate with her. I couldn't communicate with anyone. And so the next morning, around 6 o'clock, I was already at the hospital. And when I got to the gate, they were like, "No, you visitors are only allowed from 10 p.m. From 10 a.m." And I got there around 6, half past 6. So I had to go and sit somewhere while praying and hoping that I would get a call confirming that she had delivered. So lo and behold, at exactly 10 o'clock, they allowed me to enter the hospital. I entered, I got there, and I found my wife, with my firstborn. And when I got there, they had already given her pampers, given her everything, even fed her and fed the baby from the government's coffers. I didn't pay for anything. They had given her sanitary pass and everything. I didn't pay for anything. I was completely shocked because where I come from, you need to pay for all these things. But South Africa provided this service without paying a cent, without me paying a cent for it. So we came back home, and I told my wife that I would love to go to school. I would love to study. I would love to understand how South Africa is doing this thing, because I was thinking that as a third world country, this thing was not possible to be done in here. So I enrolled on the program, and lo and behold, I studied public administration. So further, so later on, I got to realize through my studies that given the fact that South Africa is coming from a past that was so uneven against black people, the government, and because the apartheid system, they deliberately put a lot of black people in impoverishment. No, no, put a lot of black people in economic impoverishment, and the government had to come up with policies like this to ensure that those who cannot afford medical care are being taken care of by the states. So at the end of the day, the government had to make it a widespread policy to cover even the rich, as long as you enter a public, health facility. And so from the one I entered South Africa, I've never paid a cent for medical care unless I decide to go to a private, hospital, a private doctor, to go see a private doctor. If you go to a public South African hospital, you don't pay anything. You don't pay regardless of your nationality, which is why I love this country, which is why I love South Africa, which is why I and my family would always, I wish South Africa would open its doors to actually accommodate and welcome, you know, I'm not saying that they're not welcoming, but to say that if you're born in South Africa, you have that right to gain nationality, the country's nationality, so that my children, whatever the potential God has deposited in them, which is the reason why perhaps this government, the South African government, allowed my wife to give birth here without having to pay a cent or a dime for it. That potential will be beneficial to South Africa. That is my prayer, that my children will become people who will offer help to South Africa, people who will come with innovative, products and ideas to help, lift this country, beautiful country of South Africa up. What I experienced there in 2016 really blew my mind. I never expected that. And lo and behold, my second son came, and similar thing happened. We never paid a cent for health services. We didn't pay anything up until now. We have not paid a cent for any medical care with regards to my children. And so I love South Africa because of what South Africa is able to provide. And I have always, spoken to my friends back home in Ghana and told them how South Africa has been able to achieve it, and that if South Africa is able to do it, it means that many African countries can do it. As much as our budgets are very different, I believe that with priority, if we prioritize health, but health is very important. Imagine somebody getting a pregnant woman who is in labor, goes to enters the hospital, and once she gets to the gate, they ask for money, and that woman doesn't have money, and she's turned down, she's turned away to go and give birth at home or go and die at home with the baby. It doesn't make sense. And that very moment in 2016, I realized, and I began to think about how many people, how many women have lost their lives because they couldn't have access to medical care, because they didn't have the financial means to procure medical services. How many children have died due to lack of accessibility of medical care. And so South Africa, I could go on and on and on and on and on and on. South Africa has done so much for me. I love this beautiful country, and not because it has done this for me, but the fact that the South African government thinks so much of the poor and the most impoverished. calls for them to be commended, because not many countries have been able to do this, and not even the so-called advanced countries have some of these policies. In fact, if if I were to talk about what the South African government, has done in the past 27 years, you'll be shocked that in the last 27 years since 1994, the South African government has built over 2.5 million houses for poor South Africans who were previously disadvantaged due to the white riches system. And so South Africa has done so well as we speak. Education from primary school to senior high school is completely free as long as you go to a public school. And if you're going to go to tertiary, you just apply for a bursary if your parents, or the combined annual income of your parents or of your household, is less than $350,000 range, which is about $20,000. If the combined annual income of the entire household is less than that amount, is less than that threshold, you qualify to enjoy free tertiary education, which makes a lot of black South Africans qualify for it, because a lot of black South African households earn less than that amount. And so almost every South African child who wants to go to university, who wants to go to technical training, who wants to go into vocational training, as long as that institution is public, even if you go to a private school, you can apply for a bursary, and then the government will provide that bursary for you to go to school. And when you're done, you pay it back in installment. That is what the South African government has been able to do. We are talking about a third world country that was in apartheid for so many years, that was disadvantaged for so many years, that was excluded from taking part in global affairs. But today, South Africa has become a model state. South Africa has become so much advanced, in the sense that I see South Africa as a country that that many of us, many of our brothers on the continent can learn something from. We don't have to send our students overseas. I mean, to America, to Europe, to Australia, to China, to go and learn. We have strong institutions. South Africa has some of the best educational institutions in terms of tertiary institutions in the world. They use it in the likes of University of Cape Town, University of Wits, University of Johannesburg, Stellenbosch University, Durban University of Technology. All these universities are world-class institutions which rank within the top 500 universities in the world. And so we don't need to send our children overseas. We can bring them here, let them study how South Africa has been able to achieve all the successes that it has achieved in the past 27 years. I'm not talking about the some of the legacies of apartheid. Of course, you can still see some of the legacies of apartheid being good or bad. But I am saying that what the ANC government, what the black government has been able to achieve in the past 27 years is worth emulating. And if we as Africans can, begin to, analyze each other and look at ourselves and use ourselves as a peer review, as colleagues on the continent that are worth, learning from each other. Trust me, we can achieve something that is so great. We can achieve something that is so worth emulating, that is so worthy to learn. South Africa has done so well. Like I said, there is free medical care regardless of where you're coming from, regardless of your nationality. It's I've always said that. No, how about, even if foreign nationals will not pay the full amount, let them pay at least a quarter, at least a certain amount for medical care. Because I've always said that, because not every foreign national we see a qualify, pays tax. So let us make it like, but the South African constitution is so liberal and so welcoming, to the point that it says whoever lives in South Africa must enjoy the rights of South Africans as well, apart from the right to vote. And so South Africa has done so well. South Africa is one beautiful country that many people are not talking about. Many people have always looked at the negative part of the country, and the media do not portray the positive side of this country. It is beautiful to talk about this beautiful country of Nelson Mandela. It has done so well, and I believe that with the right political leadership, this country can achieve even more. Providing free medical care, providing free education from primary school through to high school and through to university, or through to tertiary education, providing this is road safety and road accident fund is one of the best in the world. In fact, they even call for people who are in accident, who have had accident and had their records taken, to come and claim their benefits. That is what is happening in South Africa. If you've had accident and the accident was recorded and you suffered any damage, you qualify to be paid, to be compensated by the road accident, through the road accident fund. And it is strong. I've always said that if I'm paying something, if I'm paying taxes, if I'm paying VAT, I don't even bother about it, because I know that what I'm paying for is going to work for me. This is why I love South Africa. This is why I feel that this country has something unique, which the rest of the world are not seeing, because the media is not talking about it. South Africa is one beautiful country on the African continent that we as Africans can emulate, can learn so much from. We as Africans can learn so much from South Africa, because this country has achieved so much since the past 27 years. And it's one of the best countries on the in the world in terms of GDP. It has the highest number of middle class population in the world, which tells you that this country is on the ascendancy. It is growing. It is really bringing up those who were previously disadvantaged into the mainstream economy. And so it is beautiful to talk about South Africa. South Africa is great. South Africa is a beautiful country. This country has done so well in the past 27 years. I've spoken so extensively about this country. I've had so many engagements with people with regards to what South Africa has been able to achieve in the past 27 years. And I believe that we need to focus on the positives of this country, and that we can learn so much from what they've been able to achieve. I am Bennett, and I love South Africa. I must say that I love this country. I love this country so much. Whether I'm here, whether I live for Ghana, I will always love this country. This country made me a father. This country gave me the opportunity to be a father without having to even think of paying for medical bills. If my child is sick today, I take him to the hospital, and I don't pay anything. I don't pay anything. Myself, if I fall sick today and I go to the hospital, I don't pay anything, even though I'm not a South African. I don't pay anything. I don't pay anything. I remember when I got to the hospital, I was like, please, could you discharge my child, my wife, so that we could go home? And the nurses were like, why are you in a rush? Why are you in a rush? Just take your time. Your wife will be fine. She's already fine. She'll go home the next day or after, and you enjoy your child. I was shocked, because in my country, once you give birth, even though you paid for it, but once you give birth, you're forced to leave because somebody wants to occupy the same bed. But here, they accommodated her for like 2 days before they discharged her, even though she gave birth without any complications. So this is why I love South Africa. This is what I want people to talk about when they're talking about South Africa. This country, in spite of all the negatives, in spite of all the in spite of all the so-called flaws, I still see South Africa as one of the best countries in the world, if uh, the best country in the world. In fact, this country pays 17 million people free money. When I say free money, it's social grant. This country pays 17 million people. It pays children. Every South African child whose parents earn less than a certain amount of money are paid or is paid every single month. That money is meant to take care of the child. Each and every single child, each and every single South African child who is born today, from the day of birth, that child is being paid up until he or she is 18 years old. South Africans who are above 60, who are 60 and above, who never even worked in their life, are entitled to social grant each and every single month. They are entitled to a decent accommodation, and government is busy building accommodation for them. This is what I want people to talk about South Africa. Now, we shouldn't always talk about the negatives. South Africa has really been of help to so many African countries, African nationals. There are so many places you go to. Sunnyside, you go to Point in Durban. You find a lot of our brothers. You find a lot of African brothers who are doing so well. And so we shouldn't always look at the negative part of side of the country and always try to look down on it. South Africa has done so well. This country has done so well. It has done so massively well in terms of accommodating foreign nationals, and in terms of its policies not being discriminative. Now, it's beautiful. It's beautiful to speak about this country, and I love to speak about it. Whether I'm here, wherever I am, I will speak so highly of this country, because this country gave me the opportunity, and without any stress, to be a father of two. Thank you so much. Thank you for watching me, and thank you for subscribing.